Welcome back to Open Line. We're talking about heart health tonight, and before we left on our last break, we were talking about the warning signs of a heart attack and not waiting. I want you to pick up where you left off, Dr. Munoz.
Absolutely. So again, time is muscle. If there's any concern for a heart attack, you got to get to medical attention, not the next day, not in a week or in your 2 weeks from now for your appointment, but today. There are sort of classic or textbook signs, so chest pain, chest pressure, breaking out in a sweat without an explanation, or all of a sudden getting short of breath. Those sort of hit you right away symptoms are not normal and warrant an evaluation. And so if you feel any of those things, no points for toughness. You got to seek an evaluation. And if the result of that evaluation is, oh, by the way, you weren't having a heart attack, that's good news. You weren't a complainer, and you're not bothering anybody, because it's really important to not miss the real deal. One of the things that's also, I think, important to emphasize is that, and part of what makes my job both challenging and interesting, is that patients don't always obey the textbook.
Yes.
Right? And so there are less classic or less typical symptoms that some patients, women in particular, can experience that don't always meet the classic textbook definition. So, so back pain that comes on all of a sudden, nausea or upper abdominal pain that comes on all of a sudden. You know, and those sorts of less typical symptoms also require somebody to be aware, and also requires doctors and healthcare providers to have their radar on, just so that patients who don't come in with sort of that sign on their chest saying, I'm having a heart attack, and we don't miss those folks. And so the key is just knowing your body, and if something's not right, particularly all of a sudden, say something and get help.
I've certainly heard the stories of people who have been in the ER or gone to their doctors and done a, a fit test or whatever, and they say, oh, you've had a heart attack at some point. How do you tell that someone has actually had a heart attack in the past? What does the heart show? So
there are certain characteristic patterns that we can see, for example, on a EKG or an electrical tracing of the heart. And then there's also more involved testing that, depending on the particular patient, can indicate if a part of the heart has suffered in the past. So, and you're right, sometimes patients will be told that and never having been aware of when they might have experienced it. Some patients may say, gosh, about a month ago, I just was in bed all day with this chest pain that wouldn't go away, and I felt better the next day. And in retrospect, we say, well, that might have been it. So. Again, that emphasizes the importance of really asking a healthcare professional about abrupt onset symptoms like that.
Yeah, absolutely. All right, I do want to talk about the Congenital Heart Walk that is coming up. This is something that's near and dear to your heart, now near and dear to my heart. I've been a part of it since I've been here in Nashville. 4th annual coming up.
Yes.
And it's a great time. We changed locations last year. Now at Vanderbilt, inside.
Yes.
Tell everybody about it.
Yeah. So the Congenital Heart Walk is a partnership between the Adult Congenital Heart Association and the Children's Heart Foundation. So the Children's Heart Foundation is a national organization as well that is the largest funder of research grants for CHD. And so they have been partnering together for quite a while. And as you said, we're going to have our 4th annual walk this year, which is really exciting. So it's going to be on June 30th. From 9 a.m. to noon at the Vanderbilt Indoor Multi-Purpose Facility.
It's beautiful.
It's in the Recreation Center, so really exciting. We're going to have music and games and food and fun and raise awareness.
And it really is a chance for the CHD families to come together to fundraise, because fundraising is so important to getting research done on what causes these heart defects, how can they be treated better, different surgeries, so on and so forth. So it's important that it's done. And it really is kind of a reunion for some families with their nurses, doctors, with other families that they're used to seeing when they go to doctor's visits or have been in the hospital with. And just a really celebratory time for a lot of folks, but also a chance to remember children who have died because of heart defects.
Right. And I think that's the special thing about it is you're right. It's a time for those who have been in the hospital for weeks and months on end to just kind of come together in a fun environment and raise awareness, raise funds for these organizations, and then also for those families that unfortunately do know the devastation of loss, to be able to honor their loved one as well too.
Lofty goal this year, $80,000.
Yes.
Woo, Misty, you're setting the bar high.
We're trying to. We're trying to.
Why not? Why not, right? It's all for a wonderful cause. Okay, we're going to take another quick break. We will wrap things up when we come back. Stay right where you are.